European studies, and this I remember was frequently asked to us when we were postgraduates. Then in 1994, in the Lancet, this landmark trial came out, was published, the CLASP trial. Okay, CLASP stands for Collaborative Low Dose Aspirin Study in Pregnancy. It came out in 1994. The study was actually done over 4 years, from 1988 to December 1992, and it was published in 1994. Okay, so this was the study. This is available on the internet if you want to have a look. Okay, and it's a very, very landmark study. So what was the study? It was a randomized control study. It was a double-blinded study where women who are at risk of preeclampsia were either given a placebo or they were given aspirin. And in this study, the dose of aspirin given was 60 milligram at that time. So I'm talking about 1980s and 90s. Aspirin was available at 60 milligram. This aspirin no longer is available today. Now we have 75, 81, 150. Okay, but this study used 60 milligrams, so quite a low dose of aspirin, right? So it was a double blinded placebo control. That means one group got placebo, one group got the 60 milligram aspirin. Nobody knew who was getting what. Okay, so this was a European study. In the UK, the center was Oxford University, and they had 213 centers in 13 countries, and it was a multi-centric trial, and 9,364 women were recruited. What was the inclusion criteria? So they took women in a wide range. It was not very early, like nowadays we start before 16 weeks or before 12 weeks ideally. There, women were recruited between 12 to 32 weeks of gestation. Very importantly, there was no defined criteria to say what was the risk of preeclampsia. They just said if the clinician felt, whoever was treating the patient, that she's at sufficient risk of preeclampsia based on her history primarily, or a risk of IUGR. So it was actually done to look at prevention of both preeclampsia and IUGR. That was the primary aim of the study, not only preeclampsia, IUGR also. And women were divided into two groups. It was even given for treatment. So there was a prophylactic group where you're giving it to prevent preeclampsia or IUGR, especially in women with a history of preeclampsia or IUGR in previous pregnancy, women with chronic hypertension, renal disease. Okay. And there was a separate leg called therapeutic entry. That means women who already developed preeclampsia or IUGR, unko bhi diya tha as a treatment option. Of course, this was not found to be useful. We all know it's not given for treatment. In fact, nowadays, if a patient who's been on aspirin and she develops preeclampsia, we actually stop the aspirin. It's not used for treatment. It is used only for prophylaxis. But how do we know that? By these studies. So prophylactic entry was one group. That means women who you're giving for preventing preeclampsia and IUGR, and the other group was a therapeutic. Those who actually developed preeclampsia and IUGR, they were also given aspirin. It was a randomized control trial. The staff would call a sense. So if a patient came to and the clinician felt that, oh, she's at risk of preeclampsia, they would give a call to the clinical trial service unit. It was a 24-hour available service at Oxford, and they had got packages made by the company which were not labeled, and either they contained aspirin or placebo tablets. Nobody knew what. Okay, and the treatment was either 60 milligram aspirin or a matching placebo tablet. What were the outcomes? The outcomes were development of preeclampsia, whether the woman developed. So we are giving it prophylaxis, or did she develop preeclampsia? What was the duration of pregnancy? Did she have an early delivery because of severe preeclampsia, or did she have a term delivery? That is another thing that was seen, whether it reduces the incidence of iatrogenic prematurity. IUGR was looked for, birth weight less than the third percentile, any stillbirth or neonatal deaths, or any death of baby at any time, that is intrauterine deaths attributed to preeclampsia, hypertension, or IUGR. So these are the things that were looked for. Primarily preeclampsia, yes, but remember CLASP also looked for IUGR also. What were the outcomes? The outcomes were that it was found that 6.7% of women on aspirin had preeclampsia compared to 7.6% of those with placebo. So yes, women on aspirin had a reduced incidence of preeclampsia. It was a 12% reduction but this was not found to be statistically significant. Okay, so it was not found to be statistic. It was, yes, there was a reduction, but statistical significance was not there. However, those who entered the prophylaxis early at 20 weeks, if you started, and those who are more compliant with the drug, there the reduction was more significant. Okay, it was a 22% reduction. So it gave us some idea that yes, it might be helpful, but you have to start it at the right time. Okay, also other outcomes that were looked for were duration of pregnancy. So women who were on aspirin, they had a slightly longer period of gestation. It did not reduce, however, the likelihood of delivery before 37 weeks. Okay, so other things were there. Preterm deliveries were also looked into. But primarily, what you should remember is the effect on preeclampsia. Yes, it was there, but it was not statistically significant. Other things that were looked for, birth weight, which was not found to be not statistically significant again. Stillbirth, again, not statistically significant, and it was a very safe drug. They didn't find any adverse, unusual incidents of adverse events. So basically, the conclusion was there is a potentially important effect of aspirin was detected on prevention or delay of delivery with early onset preeclampsia. Okay, so preventing preeclampsia and probably delaying the pregnancy to probably reach more gestation. So to prevent preterm was also found. So this was, but it was a potential effect. It was not statistically significant.